Sleep-disturbed breathing is considered a spectrum. So it's good to see where you might find yourself on that spectrum to understand what is going on with the different types of conditions. So first we start off with mouth breathing. That can actually be a precursor to sleep apnea early on. So mouth breathing can cause irritation to the throat. It can potentially lead to asthma and also snoring. So that could be the first part of the spectrum. And then next we have a fancy term, it's called upper airway resistance syndrome. And that is where you have a reduced airflow into your throat and into your body from the pinching off of the upper airway. So the nose and the nasal passage going down into the throat can become narrow or already is anatomically narrow. And that function of it being narrow puts negative pressure into the throat, and it causes the throat to squeeze down a little bit, causing decreased airflow. And that can also initiate snoring. So snoring could be the next step in the spectrum. Snoring used to be thought to be benign, but with investigations into the throat tissues of people who snore, they find that the throat is more inflamed. The inflammatory cells start happening with snoring, and that continues on an ongoing basis. So the more you snore, the more inflammation you have. And when tissues get inflamed, they can also become a bit swollen or bigger. So then the next step might be mild sleep apnea, where in addition to the throat tissues being swollen themselves, you can have your tongue with gravity. When you lie down, the tongue starts obstructing the airway, the throat. And in addition to the nasal passage being potentially blocked, and then the tongue blocking the throat, depending how many times that's happening at night, you can have mild, which is 5 to 15 times an hour, moderate, which is 15 to 30 times an hour, or severe, which is 30 obstructions an hour. And then you add that all up during the nighttime, and that is quite a few interruptions in breathing. But it can be a large spectrum, again, starting from mouth breathing. Also, these things can start happening in childhood as babies. There's also a sleep apnea called central sleep apnea. And that sleep apnea is where your brain forgets to tell the body to breathe. So that is a central sleep apnea, which occurs as a result not of a tongue obstruction in the throat. The nasal passages, everything can be clear, but the brain is malfunctioning and not telling the body to breathe. So for those different types of situations, you would have different therapies. The goal is to try to get a diagnosis as early as possible to be able to use alternative therapies to CPAP machine. So for severe sleep apnea, the only available treatment to start is a CPAP machine. There's different types of machines. We'll get into those in another video. If you have a mild to moderate sleep apnea, then an oral appliance could be one treatment choice. And also importantly to do is investigate what is happening in the airway. Is there any nose issues that need to be looked at? And alternative tools that can be used, such as a breathe right strip or some nasal dilators, such, I'm not sure if you've seen them in the store, they're called the nose cones, or different tools you can use to dilate the nasal passage. So those can be available as well to help in addition to the oral appliance therapy or the CPAP machine. But the goal is definitely trying to figure this out early on so that you have options available to you. Also, if there is an intolerance to the CPAP machine, then there could be an option to fall back on the oral appliance therapy, because some kind of therapy is better than nothing.